Hello, Stéphanie Pache. Could you first tell us about your research project?
Sure. So I'm working for a few years on how gender-based violence was reframed as a public health issue in the United States, and it's a research that stems from my previous research on feminist psychology, and especially on feminist therapy, where one of my findings was how the victims of violence were the paradigmatic patient for feminist therapy, and how the rethinking of psychology in a feminist perspective stems precisely from this experience of violence, which was conflated with the oppression of women. And so that's one part. The other part is probably from my own experience as a clinician, as a medical doctor in Switzerland, and through my psychotherapy training, where I discovered that the feminist actions towards the recognition of gender-based violence was valued, it was presented as something from the past, and that now we lag beyond that kind of political view on gender violence, and we have experts in charge of it, and those experts were doctors. Actually, there was like a new unit of medicine of violence, for example, in Lausanne, where I was trained. And so I think both of those, my research and this clinical experience brought me to want to go on to understand how did we arrive in this situation where health is the accepted framework to think about gender-based violence, and mostly also to develop policies to prevent and intervene around these issues. And I mean, a huge part of my project is to understand what effects this framework has on feminism and on the politics of violence. And so I do that to mostly a history of science perspective on public health and psychology, by analyzing both scientific publications and how you say, the institutional literature of public offices. And also, though because of COVID, I did not really advance on that count, but I want to do also interviews with those authors, but I wanted to do it in person, and yeah, that's harder now. But I might do it like that also. But for now, yeah, that's where I'm going on, and there's many things currently in the literature and in the field in development. So I'm not alone asking those questions, and I think it's a great conversation to have.
And so, because you focus on the psychology and the politicization of psychology in the field of gender-based violence, how do you address the academic debates on feminism and psychology, which oppose broadly individualization to politicization?
So I think this opposition can be a fallacy, in the sense that too often these terms are not very well defined. So what is politicization and what is psychologization? And for me, I have a very broad definition of what is politicization, which is what makes an issue political is just basically dispute, in a way, an issue, and make it visible that it's a matter of values, of political stance, and not a matter of fact, for example. Which doesn't mean there's no facts, of course, but that things can be disputed. And so that's one thing. And too often it's reduced to the issue of the policies around a topic, and not necessarily about the fact that it's a topic of debate. That's one thing. And individualization, on the opposite, it can mean policies that are emphasizing personal responsibility, individual responsibility versus like collective responsibility and actions. But too often it's just think about individual action. And I think that's a problem about how we conceive what is a political action. How do I know I'm political? I am still an I subject, so I cannot speak for others. I cannot act others. So I want to do collective action, but I have to start with myself in a way. So that's why I say it's in a way it's a fallacy, because I do think political actions comes from individual thinking and discussion and interpersonal relationships, and so this division can be a little artificial. So that's one way I will say to go beyond this opposition. The other thing is epistemological. So what do we think individuals are? What is the production of individuals? And I do think we are socially produced. And so individuals are not to be opposed to society or collective, but they like part of it. And we are instituted as individuals as any other social institutions. And in that sense, thinking about individual action or responsibilities is not necessarily depoliticizing this idea. So that's part of the work I've done on feminist therapy, to try to show how the transformative project of therapy doesn't necessarily have to be apolitical or depoliticizing. Yeah.
Yes, and so your work evidences the historic ties between feminism and psychological knowledge production. So also to address those debates in the scholarly literature, what is your take on the decline narrative that frames an important part of the scholarship on the institutionalization of feminism?
Well, that's a tricky question, because yes, I do think when a project where a political project become institutionalized, in the sense that that's professions created, training programs, I don't know, clinical units or services, state services in particular. Of course, people can engage in those activities without having an activist project. And so, yes, in that sense, it can be depoliticizing. And that's a matter of fact. But I also think sometimes we have to think more, how to say that, historically, but also more dialectically. So things are intentions. And the feminist project, I should talk in plural, of course, feminist projects, were never fully institutionalized in that sense. It's not because they were at the origins of some policies that they did it, you know. It's just, so this idea that they were co-opted or whatever, I think it should be rather reframed as this forces intention, and we do what we can. That's what politics is. There's like things you can do and things you cannot do, and it's not necessarily the responsibility of the activist, but it's like the result of interactions with the system and the institutions. So that, I think, is also important to say. And so to judge if there's like a decline or like there's a negative judgment to be made, I do think you need to look, and that's maybe the more historical part, like in the long term. So exactly what was changed, what could be achieved, and what effects, and sometimes, most of the time, unplanned effects can can be seen or maybe still the object and the topic of debates and reform. And I think that's we fall into this like old political debate between radical approach and reformist approach. And yes, politics is uncertain. You don't know what you will do, and sometimes you achieve something and it has side effects that you did not want. But you know, it's always a balance of what can be done and cannot be done. So I'm not particularly fond of this like decline narrative or success narrative. I think I'm more like for the realistic thing, that reality is complex and politics has unplanned effects.
Yeah. And so if psychologization in itself doesn't equate depoliticization, and if the production of psych knowledge doesn't necessarily signal any pathologization of women and victims of violence, what are the dynamics at play in the depoliticization of gender-based violence, and how do you evidence it?
Yeah, so maybe again, it's attempts. Like feminist projects are you try to do things, and again, like there's propositions that were done, and it's documented in the literature, like feminist scholars saying, well, I defend that, but now I realize it didn't work, so maybe yes. So just as maybe a side note for what I will say, because I don't want to say that necessarily all feminist psychologists will agree, but I do think there's again that we never really, we as feminists, we never really achieved the politicization of gender-based violence. We moved forwards a few steps, and we achieved some coalitions that allowed some policies with which feminists agrees, but not all of the feminists and not all the policies, especially on criminalization, for example. But what I'm saying is just like, again, it's opposite forces in tension. And so patriarchy didn't disappear. Family values didn't disappear. And it's still seen most often than not how some kind of feminist critique of violence could be attacking the model of family, of traditional families, of course. And we still hear that often from the masculinist discourses, but more broadly. And so you can see how the children issue is treated, especially in case of violence, and how like this discourse about children need a parent, and he might be an abusive father, but he's still a father. That kind of discourse that you still hear, that it shows how it's those kind of values are still so broadly shared that we'd never really won on that. And so that's what I'm saying. It's just, that's the perspective about, was there really a depoliticization, or is there just like counterbalancing forces that is more like from like to use a term that's broadly used also by feminists, like a backlash, like a reaction to things happening. And it's always like sometimes we win a little and then we go backwards a little. That's one way to see it first. But the other part, which I think is interesting me and in you too, is the mental health emphasis. And that, again, is not just the feminist. I in my work, I showed how feminist psychology is tied, of course, this trauma discourse and this psychological harm discourse as a tool to show and explain violence and the effect of oppression on women, and how we should see differently the psychological symptoms in women and so on. But of course, they will not have succeeded alone. It's like this general tendency in our Western society to put legitimacy in the psychological discourse and to give a lot of credit to behavioral explanations from psychologists and psycho professionals, let's say like counselors and psychiatrists, of course, and psychotherapists, psychoanalysts, all these side professions that are very well developed, including nowadays neuroscientists. So that's one thing. So I'm not saying it's all the feminists who did it in a way, but that's for sure that this emphasis on mental health, on trauma, on harm was useful to show the link between oppression, violence as kind of the interpersonal experience of oppression, and the damage it was doing on individuals, and how this affects the ability of women to be autonomous and be a full subject of society, basically. And I do think we have to place that in many other like anthropological transformations of society, including how well this kind of discourse fits with the safety, the no-risk culture we live in, and how people are ready to give up their rights to be safe. And especially now in the case of violence, defense rights. So for the authors of violence. And that I think certainly contribute to the depoliticization of it. Instead of thinking about collective social power relations, we tend to protect ourselves and see about how it affects me as an individual and what can I do to protect myself. And the trauma discourse really reinforced that, because it gives the impression that any violent event can have like serious damage on anyone, which we know it's not true. But
thank you. And so how do you analyze this language of responsibilities that's like an emic category? So how do you analyze it and without reproducing an individualizing account of the social?
Well, that's another like kind of hard question to answer briefly. Again, we come back, I think, to how we view individuals. And so I make no mystery. I'm very inspired in that by Cornelius Castoriadis, and how we have to think both how we socially determined and how we socially constructed, instituted, and how this means we actually not very autonomous in our thinking and our actions, but that we can be. There's always a little part that can be creative and autonomous, and that in a way the political work is as an emancipation is to grow that little part that we can maybe work on to be more self-determined and more autonomous simply. And that means take some kind of individual responsibility. But that also means to know when we can and when we cannot. And it's just like this complex analysis of a situation, of an issue, that we have both to want to be autonomous, and it's kind of a performative action to say that I can do it, and we have to pretend we can do it, even though sometimes we can't. I don't know if I'm very clear about that, but so I do think it's very circumstantial how we rethink responsibilities. And so, and it's a real issue if you think about gender violence, like, because we have this paradox, and I think we can find that in feminist discourses on violence. So for example, if you do think there's a political determination of gender-based violence, it's like power relations between the group of sex, and then you have to recognize that men are as socially determined than women. So of course they can not be violent. And that's why you can hold them accountable for their actions legally, for example. But you also have to realize that they like socially educated, and that social norms produce that. So you cannot make them like, I don't know, like abnormal psychopath or whatever, because it will not fit the political account of gender violence. And you should have the same symmetrical view for victims. And you're always in this tension because you want to say, no, but that's a collective issue that society has to deal with. But at the same time, I want that person to be legally sanctioned. And that's always a tension. And I think in a way, in practice, we recognize this dimension of like, maybe there's mostly, we mostly act according to social norms and social institutions, expectations, and so on. But still, we have to pretend in a way that we can do otherwise to hold people accountable, even though we live in a society that actually doesn't do that, whatever people say. Actually, capitalism and patriarchy and so on are, I think, rather de-responsibilizing people and put the wrong responsibility on the wrong person. And so that's also what created such a mess, if I may. So yeah, that's briefly, it's not so briefly, but like what I will want to say about responsibility. And then we have to think also about other terms, maybe to distinguish between like the responsible as in we are the causation or a factor or an actor of something, and we are responsible and we are guilty of the thing. And I think the fault and the cause should maybe sometimes be distinguished. But that's a more like philosophical maybe a question, or legal sometimes question.
Thank you very much for your time and for your explanations.